I can't believe you're ready. Oh. I wanted to put your name on it. I got you a stethoscope too, but you're already ready. Maybe you can give it to a friend.
Did you see what I got you?
You're very welcome. You want to wear that coat so everyone can recognize? Got it? I like your shirt. So you have a special tour today. Are you ready? Okay. Let me help you. So what's going on? Wow, that's so cool. Okay. There you go. I was so worried it wouldn't fit you. Okay, which one do you want to wear? Your blue one or the other one? Okay, so start the tour at the laboratory. I'm so glad it fits. That was worried. Nice and cute. A little tight. Nice. All right, Dr. Idwinner. All right, Dr. Idwinner, let's start the laboratory, okay? All right, let's
Good to see you, Doctor.
You alright? What's your name again? Sit up. Idwinner. Okay, Idwinner. We're happy to have you here, okay? Welcome. I like your car.
No, let
I
that
know. Her outfit, so pretty.
I let that go.
Ooh, all right. Let's go.
So, let me see your card.
Oh, that's right.
That's Dr. Mia. Mia. This is Dr. Mia. Yeah, she's coming to check out the lab. You want to say hi to her? It looks like you're coming close.
Hello, how are you?
So we're going in the lab.
As a doctor, the major people you work with, the first people is the lab. You know why? Because we tell you the secrets in they tell you the person has malaria, the person has cancer, the lab is protected. So we are your partners. So this is our lab, the money lab. Have you seen a lab like this before? We are the best. Understand the difference for you. Please,
Hi, everybody.
this is Dr. Megan.
Stay away from her.
Okay, say hi to so you see them. You want to ask me a question?
I want to be charging the system.
Not yes, for every patient you actually have to do. You know why it's very important? Why is it just because everyone comes into the the sick place. Different kinds of organisms. We have bacteria, we have virus. So to put is wearing lab coats.
Hello, dog.
When lab coats, you see some people wearing gloves. Those are personal protective equipment. So those things, they could prevent you from getting sick. Which other questions you have?
Be loud.
Okay, the instruments for here, the major instrument we use is that very small one, centrifuge. Do you know what it does? It spins. I wish I could see it. I see you could see inside, but it spins so fast. When it spins fast, it separates the blood from the liquid portion of the blood. And we use the liquid portion and leave the solid part. So this is the most used one. Okay, this one, we have this one. Another one so this will tell you very small things like the bacteria machine. If you cannot see, we cannot see it with our eyes, but the microscope will help us to see it. It will make it very big for us to see it. Which other question? Okay, this is another question. Okay, we have science, we have different groups. We have scientists, we have technologists, and we have technicians. It's based on what degree you have. So this is a technology, you see it's written in lab technologies. Mr. Mohammed Ba. Have you met her? She's also aspiring to be
that? Dr. Idwinner. Welcome.
Any other question? I was expecting to ask how many women are in the class. Okay, this one is a UPS. This one is not connected to lab, but this helps step down the electricity that our instrument is giving, so that it will be so hard and break the instrument. It's a generator. That big one is the cell. So that one is for us. This one is for us. These are all speech. So you know when you speak yourself, the blood is all blood. Red. But we don't want to see only red things. So every cell has different colors that it shows on the microscope. So in this the rest are men. So that's not women. Please join us.
Is there anything she can look at on the? I think the newspaper or something. Yeah, I did.
This all looks like round things. Round circles. You can look inside.
You want to sit down?
Sit
Yeah.
down. You see something? What I see? Yeah, but you know what? I want you to describe what I know that you are seeing. Great, that means you are seeing something. So those a lot take time. So those plenty, there are some that have plenty dots. Those are red blood cells. They are the most populated cells in the body. Then there's a funny looking purple one. Those are white blood cells. When you go medical school, you tell you the difference of the white blood cell and the red blood cell. But they all come out when their body needs it to perform. The RBCs are the most populated one. But sometimes the WBCs come out because you are sick. You're welcome. You're welcome. I hope to see you. Help, please.
Yeah, sorry.
Y'all can do it again.
Thank you, Mohammed.
Okay.
Is that our kid? Hi, how are you? I saw your letter. It was so amazing. You okay? What's your name? Sorry? No. I see that you aspire to be a medical doctor in the future. Keep your dreams alive, okay? My name is Idwinner. I work with the Audit Compliance Department. I'm the Audit Compliance Manager. It's a pleasure meeting you. By the way, I like your outfit. We give reports on reconciliation. We do daily revenue where the money that is made for medical services, we can show that it's correct. Every transaction, what's everything to the bank, then we do the reconciliations too.
Yeah. And then they pay doctors like you.
Of course, that's where the finances come from.
Yeah. Okay, let's keep it moving. Let's see what else is to see. So over here, a few appliances. You know, all your doctors, you need the test tubes, you need some papers, you need some gloves, most importantly, right? Of course, I'm going to take one. Just gotta open this one. I hope I don't get infected. Well, you know, you have to protect your hands at all times. Maybe there's some germs or something the doctors don't want to get sick with. So let me put it on. Alright, Doc. Is this the right way? Perfect. Got it. Already. Barney, I'm so sorry. I had to steal some clothes. So this is Mr. Barney. He helps everyone get everything they need. So he'll help you too when you join us. Got it? Okay, what else can we? Oh yeah, you saw him a little bit. Tracy. This is Tracy, and this is our new doctor. Oh, sure.
Well, what's that?
So if you have insurance to work, and your insurance doesn't cover, you can call us. We can help you if you come back in next week. We can go try that to get your health secure and everything. So welcome to Jamale. We have fire happening now. Thank you too. All right, we'll come back later. This is under your chair. Here we go. All right, so now we're going to go upstairs. Good morning, everyone. Meet our doctor. Is that my doctor? Good morning.
That's my head. What am I going to do? Will you examine me?
What is yours?
I'm breathing, but I'm in pain. Yeah. Doctor, will you give me injection? I don't like injection. You can give me tablets. Thank you, doctor.
Good morning, Dad. Good morning, how are you? I'm having problem with my chest. Can you please tell me what exactly happened to me?
So you put it inside the blouse. Maybe take more.
She does our mammograms. You know, sometimes they have to check women's breasts. That's what she does.
So I take each of the first for cancer. My name is Namates, but I'm not a body.
And this is Miss Yvonne. You just checked her. She helps us organize everything and everyone. She's very special. What's her name?
Dr. Amin.
Transactions. Are you Dr.
Good morning. It's a pleasure. I'm Julius.
You have any questions for him?
No question for me? Oh, no question. Just ask me one. The computer. So it's used for us to import all of our documents and everything from financial documents to import those right now. This one? Oh, so
Alright, so come and meet these amazing ladies over here too. She helps us get everything. And Miss Romina, she brings us sweets all the time. She bakes, she does amazing stuff. So when you're hungry and you come to work, we can find her. All right. Let's go meet these ladies.
So, I asked me,
And this is Mr. Arthur. You guys tell me a little bit about you.
Oh, okay. For a company, we work in QuickBooks, online operation. QuickBooks is a financial instrument that we use to call financial transactions. In QuickBooks, we also do our daily reports.
All about that.
this is our young doctor.
Yes, welcome. Hi, how are you? You have done double? Welcome to Jamale. This is our monitor, and this is the CPU. This is where we do all our computer work. And Miss Stephanie helps us get everything. All the things you see here, she helps us buy them. So she's very important.
Hi, doctor. How are you?
welcome. My name is James Russell.
He's also in the department we went to, the audit. So the same man who helps with the money, makes sure everything's all right, and then we pay doctors like you. Yeah. So when did you know you wanted to be a doctor? Always? What? That is so cool. Doctors are the most important there is. Huh? Okay. I think that's amazing. Kids are very important. And the Dr. Glenn, she also treats kids. Yeah. And then of course to be a pediatrician. Oh, you have your first patient. Oh, can I take a picture? Yeah. Smile next to your first patient.
Oh my gosh, beautiful. Thank you. All right, let's find Dr. Morris.
Miss Cole. Morning, my name is Cole. I'm the nursing supervisor. This is Yasa. We're the nurses on the floor here. You want to put them up? That's a very, very big, huge shoes of the Now, I'm sure you have a lot of questions, so when you get to the doctor, make sure you ask them all the questions, yeah?
Is Dr. Morris available to see her?
Yeah. Whenever I tell you, if you touch anything that she's using, then you always listen to the sanitizers that puts the whole around, okay? Remember? Oh, she's not going to stuff on.
Wait, just a little bit. Do you have any brothers and sisters? Oh, how old are you?
Oh, so she has to wait a bit.
Awesome. Don't be nervous. Well, you know you're on holiday, right? Now you're not going to school. So how are you spending every day? What do you do? You have some at home? What? Dr. Morris also has some for you too. Yeah, so maybe I can be your patient if you don't mind. I'm not a kid, but I can be okay. Great. Nice. Everyone was so excited to meet you today. Yeah. Are you the mom? Yeah. Oh my gosh, she's so brilliant. You must be so proud, right? Sure. That's great. When I was communicating with, I think, her father, he was like, she is so excited. She loves to take pictures. Yeah. So maybe we could get a nice video together when we're leaving.
Yeah. Excellent. So you can call the first patient. What's the area of specialty?
Oh, Lord.
What's your area of specialty? Which children? Do you see children? Do you see adults? Do you see women? Children. Very good. So you'll bring all the children today and come to see Amina.
Sounds good.
Okay? You remember my name? The corner one. What does it matter? Henry. You remember Henry? Henry.
You can ask him any question you would like. Yeah,
So
actually,
you
that.
ask me any question?
Nice. Okay.
Sorry for that. So you and myself, who's the doctor? Both of us, right? So you know what? So just bring that stool and come and sit right here.
This one.
Yes, just drink that stool. And a general practitioner. When we say general practitioner, it means I can see everyone. I can see children, I can see men, I can see women, I can see the elderly, I can see someone who was involved in an accident and need some suturing. Yes, okay, now what general practitioners? In the developed countries, like America and others, they have what they call family practitioners, meaning the person able to see the whole family, the baby, the ma, the pa, the grandma, and the grandpa. So I am, just one second, let me see. So I am But I also did some surgery before, so I know how to operate also. Yes, you see, organizing the army. All right.
What are your goals for your patients?
My goal for my patient. The very reason why I'm a doctor, I have a passion to help the sick. So therefore, because I'm a medical doctor and I have a passion to help people who are distressed, who are sick, my primary objective in the morning when I pray to God, before I come to work, I say, God, be that big physician in my office. Because no one person know it all. So that everybody walking out of my office, God has touched them. Okay, and help me so that God can. Because when they go home, they say, oh God, thank you, I'm better. They're not gonna pray and say, oh Henry, thank you, I'm better. No, right? So I give, when people come to my office, most patients like me. You know why they like me? Because I take something away from them. And what I take away from them is that sometimes they think nobody care for them, nobody touch them. Sometimes just caring for your patient, joking with your patient, talking with the patient. You know the patient walk over here, you know what they tell me? Oh, doctor, I will always come back to see you. You make me feel so good. So to answer your question shortly, my objective is to make a change in the life of anyone who comes to see me as a medical doctor.
How do you deal with
You know when the patient get away, you know what they do? Sometimes I come to work, I'm sitting in my office, they bring me a whole goat, they bring me chickens, they bring me everything just to say how much they appreciate what I've done. So therefore, it is an excellent feeling when you help someone.
what are the most common illnesses and diseases you see
What are the most
illnesses and diseases
illnesses and diseases that we see every day?
that you deal with every day?
The first one, malaria. We live in a malaria endemic country, meaning malaria is all year round here. Because you know what can give malaria? Mosquitoes. And you know the thing that can bite us at night, sometimes during the day, they are the ones that give malaria. Okay, so it's common. It's common. Malaria, typhoid is also common. Okay. Some of the diseases with the respiratory tract, cold, cough, those simple things we see them a lot during the course of the day. And we also see some big things too, but those are the simple ones. Somebody's stomach running, because they're just like me, right? Oh, you say you see children. Oh, okay. So you see children. So where do you practice every day? Oh, so. But anyway, thank you so much for coming. And I do appreciate you. Um, and one day, I don't pray that you'll be a patient. But one day when you come as a patient, then you will see the other side of me why people tend to like me. Okay? Thank you so much for coming. I appreciate you. And your ambition.
How are you, sweetheart? It's such a pleasure to meet you. My name is Dr. Morris. I'm one of the doctors here, and I hear you want to become a doctor too. Wonderful. I'm so glad to hear that. I look forward to seeing you as a doctor, and I will come to you as a patient when you're a doctor, okay? Hello, you must be her parents.
Yeah,
Hello, I'm Dr. Morris.
I'm Idwinner Morris.
Oh, hello, Lydia. Nice to meet you. And is this Dad?
No.
All right. Never seen.
What are your specialties?
That's a very good question. So I am
apologies. This always happens when you're a doctor. Your phone is always ringing when you're trying to talk. I am, so depending on where you are in the world, the name is different. So I did my medical training in England, and in England they refer to it as general practice. But here in Liberia and in the US and some other places, they call it family medicine specialty. So I basically, I look after the whole family. So everyone from babies, adults, older people, women, men, everyone. I feel grateful. Grateful to God, first of all, because God is the only one that heals. Okay? No knowledge that we can attain as doctors can surpass that which God can do. So I feel that I'm like a servant of God, working in His interest and with my limited capabilities trying to help people so that people get better. I first of all praise God because He did the work, and I'm grateful to have been there. So it feels great. Wow. My goals for my patients, really that they experience peace, joy, fulfillment in their lives. And I know in order to do that, their physical health is part of that process. So whatever I can do on my part to help them be well physically, to enable them to live the life that God has for them to live, that's my goal. So for me specifically, so as I said, I trained in England. I was living in England at the time. I'm Liberian, by the way, but I left Liberia when I was 9. How old? You're 11, right? 8. Oh, you're 8. Okay. Wow. Okay. So yes, I was a little bit older than you when I left Liberia, and I first moved to the U.S. and then my family moved to England, and so I did a total of 4 years of college first, and then I did 4 years of medical school, and then I was officially a doctor. So I had the doctor in front of my name. And then I had in the UK, in England in the UK, I had to do 2 years of just general postgraduate training after becoming a doctor, where I had to rotate around all the different specialties and learn a little bit about everything. And then I did another 3 years of my specialty, which is family medicine practice. So a total of 5 years after medical school. So 4 years of medical school plus another 5 years. So it's kind of long. So I had to be patient. Okay, so the first thing is to greet them, put them at ease as much as possible. So there's what they call verbal body language, and then non-verbal verbal language, and non-verbal body language. So what you say to them, and also how you respond. Like if you smile, if you are at ease, all of that already puts them at ease. Because the process of getting better isn't just the medications you give them, but the care you give them as well. So from the minute they walk into your office, they should feel like, I'm gonna be helped. I'm gonna feel better, and that will already make them start to feel better. So that's the first thing. Then they sit down, and I give them time to tell me what they want to tell me without interruption. I let them talk. Then when they stop, then I ask my questions. Okay, because first they need to tell me all the things that they want to tell me, and then I will have my specific medical questions that I want to ask. I ask those questions, and then I will also want to know about their past, what has happened to them in the past with their, medical problems, all of the different things. Even ask some different questions, what they do for their job, depending on the situation, what kind of food they eat, lots of questions, and then I examine them. So to examine them, I take them over there, and then
for most all patients, basically, I generally do a full examination, so examine them from top to toe, and then after that, I'll come up with a plan, like these are the tests I need to do, and this is what I'm thinking might be going on, but I need to check for this and that and the other, and then I tell them that plan, and then they go and do the test, and then they come back, we go through all the results together, and give them some treatment. Must have amazing parents who are raising me so beautifully, and I'm thankful for them. And I will, I just encourage you to, first of all, put God first, and just go for it because.